Dr. Laws?
Thank you, Michelle, and pleasant good afternoon to everyone. The Ministry of Health, the Federation of St. Kitts and Nevis continues its COVID-19 vaccination program. It's approximately 1 year since we've rolled out our COVID-19 vaccination program, and to date, we have achieved the following coverage rates. 82.4% of the adults in our population having received the first dose, 77% of the adults in our population have received 2 doses or are fully vaccinated. 9% of the adults have come forward and received the booster shot. In terms of our children aged 12 to 17 years, 18.2% of children in this age group have received the first dose, and 16.4% are fully vaccinated. So we continue our COVID-19 vaccination program because the COVID-19 vaccine is the first line of defense, really, against this coronavirus or the COVID-19 pandemic. 55.6% of our total population is fully vaccinated, and this slide provides you an idea as to the data disaggregated by island. So 77% of the adults in the Federation are fully vaxxed. 80.6% of the adults in St. Kitts are fully vaccinated. 67.5% of the adults in Nevis are fully vaccinated. And you see the corresponding numbers for the teenagers. Please note the new international or global target is to aim and cover 70% of the population with COVID-19 vaccines. And so all countries globally are trying to achieve this goal. We are well on our way in terms of our having almost 56% of the population already fully vaccinated. Just by way of information, the government of St. Kitts and Nevis over these past 2 days received the 3rd tranche of the Pfizer-BioNTech vaccines from the United States government. So over these past 2 days, we received a total of 18,000 doses of the Pfizer-BioNTech vaccines, and we are expecting another batch of the AstraZeneca Oxford vaccines through the CARICOM Secretariat tomorrow, Thursday, and we expect 3,000 doses of the AstraZeneca Oxford vaccines tomorrow. Now, this shows data over this past week. So over this past week, 20 persons were added to our COVID-19 tally. They are newly diagnosed, as compared to 42 in the preceding week. In terms of the number of persons or cases recovered, we have had 12 this past week as compared to 208 in the preceding week. And so, ladies and gentlemen, we are almost at the end or out of this 4th wave or 4th outbreak of COVID-19 infections. Our numbers, meaning the newly diagnosed cases, are trending downwards. The numbers are declining, and we continue to see our cases recovering. This current wave, during this current wave, December, that's 2 months, almost 2 months, we've added 2,686 newly diagnosed cases within this past 2 months. We've had, there seems to be an error. We are following or monitoring 68 active cases at this point in time. And during this past month, we have had 12 COVID-19 related deaths. Now let's just focus on, we want to pause and extend our sympathy to those who have, the family of those who have died recently as a result of COVID-19. These 12 individuals, when you look at the data, 11 out of the 12 were unvaccinated, so 92% of the recent cases unvaccinated, only one was fully vaccinated. And in terms of age range, 92% of these cases, or 11 out of the 12, were older adults. They were over 60, and they all had chronic underlying medical conditions. And so again, I keep saying this repeatedly, the older adults amongst us, those who are unvaccinated, and those who have underlying chronic medical conditions, they are vulnerable. And so these are the individuals we want to reach out to. They should be our priority in terms of trying to empower them with the information such that they can, come on board in terms of accepting the COVID-19 vaccine. In terms of our response to COVID-19 over this past 2 years, we've had a total of 40 persons dying as a result of COVID, 7 from Nevis, 33 St. Kitts. 2/3 of these individuals were male, so there seems to be a higher risk of dying from COVID just by gender alone, male. And this is in keeping with the global trend. In terms of these 40 individuals, majority of them were unvaccinated, or 88% of these individuals were unvaccinated. A majority, 78% of these individuals were older adults. And so, I want to just pause and, just speak directly to the older adults in our population, those older adults who may be tuned in this afternoon, who may be listening. Once you are over 60 and you are unvaccinated, you are vulnerable. You are at risk of picking up COVID, and you are at risk of moderate to severe disease. You are at risk of being hospitalized as a result of COVID, especially if you have any of these underlying medical conditions: diabetes, hypertension, heart disease, kidney or renal disease, stroke, cerebrovascular accident. So if you've had a stroke in the past, that's significant. And if you have been diagnosed with cancer. So if you have any of these underlying conditions and you are not yet vaccinated, we really want you to reconsider your position, because it's individuals like yourself who are at risk of moderate to severe disease and even dying. And we want to prevent any further deaths in this regard. And so I just want to try and, convince you, if you are hesitant about the vaccine, what are the factors contributing to your hesitancy? Is it that you have concern about the safety of the vaccine, or is it that you are not convinced about the benefit of the vaccine to you? At the end of the day, we want to be able to convince you and bring you, and you are coming on board in terms of accepting the vaccine. So, vaccine safety. Please note that in terms of the Pfizer-BioNTech vaccine, over 10 billion doses have already been administered, and very little adverse or significant side effects. In the Caribbean alone, you have over 24 million vaccine doses being administered. In terms of St. Kitts and Nevis alone, we have administered over 57,000 doses of the vaccines combined together. So in terms of safety, it's relatively safe if you have diabetes and you're taking your medication, if you have hypertension, if you've had a stroke. These conditions are not contraindicated. They do not prohibit you from taking the vaccine. Innumerable persons with conditions like these have already come on board and taken the vaccine. This slide provides you the current COVID-19 situation on the ground. So to date, 5,508 cases have been reported by the Federation. 5,400 of these cases have already recovered. We are monitoring 68 active cases, and as I said before, we've only reported 40 COVID-19 related deaths. And then these are just a reminder about the COVID-19 preventive and protection measures. The vaccine provides you that layer of protection against COVID, even Omicron, which seems to be milder, but yet still the older adults are succumbing to it. So we want you to really rethink your position and accept the vaccine. The wearing of the face mask is very important. We want you to maintain adequate hand hygiene and safe distance between yourself and others when you are interacting in public spaces. And if you are ill, experiencing any of the COVID-like symptoms, we want you to remain at home and not interact with others. Thank you.
Thank you, Dr. Laws, for your presentation. I would now like to invite Superintendent of Police, Mr. Cromwell Henry, for his presentation.
Thank you, Ms. Rodriguez. A pleasant good afternoon to all listening to this broadcast via whatever means. Today I will touch on the protocols and the procedure for hosting social activities. There are a lot of misunderstandings and misconceptions about what is supposed to happen, so I would attempt to clear the air on this today. Following the announcement last week by the Honorable Prime Minister regarding the lifting of restrictions on mass gatherings, I will again outline the procedures, but I will first put into context the lifting of restrictions that the Prime Minister would have referenced. Early in January, Honorable Minister Phipps announced that Cabinet had restricted the granting of permission to host events with mass gatherings as a consequence of the COVID-19 outbreak then. This restriction was intended to remain in effect until March. I would have mentioned this restriction also in my presentations subsequent to the Minister's announcement. Due to the good cooperation of you, the public, we saw a steady decline in the number of new cases, new COVID-19 cases that is, and a significant reduction in the number of active cases long before March. And if you would have just heard, the CMO would have said that we only have 68 active cases presently. As a result, Cabinet, on the advice of the National COVID-19 Task Force, removed this restriction effective February 12th. The COVID-19 Prevention and Control Act, which sets out the procedures and protocols which are intended to prevent the spread of the virus, has not been amended. All the protocols and procedures for bars and restaurants, sports, and other social activities remain the same. The basic guideline and requirement to host social events with more than 25 persons and for events where bands or DJs are expected to play in any public place is an application for permission sent to the Commissioner of Police via our website, police.kn. We are very generous with permissions at this time. However, we are very particular with the number of persons permitted to attend events in the enclosed buildings. This is not only in keeping with the social and physical distancing protocols, but it is also a safety consideration for us because of the risk posed by overcrowding a venue, especially enclosed buildings. We therefore ask organizers and promoters of events to pay attention to the size and type of venue when planning your events. Enclosed outdoor venues are preferable and safer. We again remind you that all COVID-19 prevention protocols are still in effect. Social events are required to get permission, and persons are required to wear face masks at these events. In closing, I would leave my usual admonishments to you. Avoid crowds and crowded places. Practice good hand hygiene and other sanitizing behavior. Maintain a physical distance of 6 feet from others when you are in public, if that is possible. And of course, where possible, get vaccinated. Thank you.
Thank you, Superintendent Henry. I will now invite Mr. Abdias Samuel, National Disaster Coordinator of NEMA and Chair of the National COVID-19 Task Force, to give us his presentation.
Thank you, Michelle, and a pleasant good evening to all viewers, listeners via the various mediums. Today, I want to bring some attention to a number of activities and actions that the task force has been engaged for the past week since we last engaged you last week, Wednesday. One such is the meeting that was convened with the chairman of the St. Kitts Music Festival, Mr. Damian Hobson, who was also accompanied by Mr. Val Henry, regarding the safe hosting of our music festival in St. Kitts, scheduled for the month of June 2022. That's this year. We would have looked at the protocols. We would also look at the layout of the venue, and we have been deliberating as to how to advise Cabinet on this matter. So to the general public at large, if we continue to do what we are doing in keeping these cases down, in keeping the country safe, there seems to be the potential for music festival to come back this year, since being away for the past 2 years. We would have also engaged, and I must say happily engaged, the St. Kitts Amateur Basketball Association, which was led by Mr. Glenn Jeffers and supported by Mr. Wendell Pemberton and Mr. James Barman Hanley. I always call him Barman, my old coach. They made a great presentation, and I would like to advise the general public that this is an exemplary presentation in terms of the sporting sector, whereby they were able to inform us that out of 175 active basketball players, they have 104 players fully vaccinated. That's approximately 60% of the league. In that regards, we were quite pleased and satisfied, and I am certain a great nod of approval would be given based on precedent set before for the commencement of the SCABA League. According to the schedule, SCABA League is desirous of beginning in March. I think the first match would be on the 13th of March. So to the SCABA executive and all their staff, support staff, we say thank you. And to the players, thank you for being responsible. As a former basketballer, a good one at that, I am happy to see that the league is back up and running. We also would have had a presentation and met, well, we also would have met and had a presentation from the Cricket Association, and this was done by the president, Mr. Dennis Phillip. And I must say that we were quite pleased with the information shared in terms of the protocols and the procedures put in place by the St. Kitts Cricket Association, St. Kitts Nevis Cricket Association. The beauty about them, the advantage that they have is that we would have safely hosted CPL and also the West Indies under-19 team. So we are hopeful that the cricket enthusiasts will be pleased to know that hopefully the league will resume soon again. Just a while ago, would have had a nice conversation as well with the president of the St. Kitts Nevis Football Association, Mr. Tiba Harris, where we discussed finalizing the protocols for the resumption of the Senior Men's League. I know this has been a challenge, and we are rather mindful here at the National COVID-19 Task Force, and I am certain that the ministry itself, as well as the government, is also desirous of ensuring that this league commences in a safe manner. We are hopeful that by next Tuesday, when we meet with the executive of the SKNFA, we can finalize all the terms of agreement for the safe resumption of this league. So again, I want to commend the president himself for the hard work that he has been doing. For example, he has been doing his research, talking to his regional partners. I know he would have stated that he has been in dialogue with Anguilla and other islands in terms of what they have been doing for the safe resumption of football. So to the footballers, I think your turn is coming very, very soon, sooner rather than later. We also, at the task force level, deliberated on some of the scaling down of the protocols. And I'm happy Superintendent Henry would have brought some clarity because persons thought that when the Prime Minister would have made his presentation, it meant no more masks, it meant no more testing, no more application when coming into the country, etc. And the clarity is this was for social events, mass gatherings. However, in deliberations yesterday, we recognize that there are some other protocols that are put in place, or procedures, let me say, that are put in place that can be scaled down. Again, that can be scaled down. For example, the taking of temperatures, and 2, the recording of names. Again, we are going to leave that to your personal responsibility at the business level, at the personal level. If you want to continue taking temperature, that will be your responsibility. It's not a requirement at this time. If you want to continue recording names, that will be your choice, your responsibility. We think that that is not a requirement at this time. So taking temperature and the recording of names is something that we are recommending for persons to scale down on as well. Now, I have been receiving a lot of inquiries about, from taxi operators in particular, about the removal of the barriers. And this was tabled at our discussion as well. And the recommendation is that we are still getting out of the wave. Let us get out of this wave, then we can revisit that particular matter. So give us some more time. We are appealing for some more time. It's going to be a gradual process for us to scale down and continue to scale down on the protocols. So bear with us, please. Ladies and gentlemen, I know some of you have been very supportive. You have actually become religious toward the NEOC briefings. Some of you do look forward, and then when there's no briefing, you call and find out why there's no briefing today, etc. However, as we scale down with everything else, we have to scale down laterally across the board. So I want to inform you that on the approval of the Mitigation Council chairs, they have agreed that 1, we will have 2 more briefings in the month of March, and then we will have one briefing in April which will signal the end of the NEOP briefings for the past 2 years. What will happen from there on is that we will have briefing based on situational demand. So if there's a situation that demands the sharing of information, then we will have these briefings. So this is where we are going to go in terms of scaling down as well. I would have indicated this to you last week, and I am now presenting to you how this will happen, how we will transition. Bear this in mind, though, that you can still get the information on the COVID-19 website and also on the various social media platforms, whether it be the police, Ministry of Health, NEMA, and other government agencies such as Tourism Authority. Let me just encourage you to continue to prepare. I know it's early, but it's never too early. Please begin to prepare for the 2022 Atlantic hurricane season. It's important that we do so, so that if we are affected, then we can respond appropriately. I also want to, at this time, encourage the population, residents, citizens of St. Kitts and Nevis, the general public, to support the 2021 census. Shape the Future Census 2021. It's me, you, us, 2021 census. Again, it's me, you, us, 2021 census. Ladies and gentlemen, I think we have had a great journey together. I'm hopeful that Superintendent Henry, as the only person from among us who has not gone on vacation, can get a well-needed vacation when we scale down, and as we scale down more. I know he's going to have it a little tougher because the amount of applications for activities that he will have to process and deal with will be a lot, but we are hoping that out of all of us in here, I think he's the only one who has not gone on vacation as yet, and I'm hoping he can do so. I'm hoping that Minister Phipps as well can take a well-needed vacation as well, and the Attorney General. Mr. Williams, please enjoy your time wherever you are, and we are hoping to see you soon again. Thank you very much, everyone, and we will see you again at our next briefing.
Thank you, Mr. Samuel. And we have now come to our question and answer segment. There are two questions that came in from Von Radio, and I will read them. It says, will the government be seeking more vaccines for the largest vaccinated group in the population, that is adults, when St. Kitts and Nevis transitions into an endemic stage later this year? And two, will the COVID-19 vaccines have to be paid for once the Federation transitions into endemic stage? Dr. Lodds?
I think I answered the first question already in my presentation. The government continues to seek additional doses of the COVID-19 vaccine. And so between yesterday and today, we received 18,000 additional doses of the Pfizer-BioNTech vaccine. And tomorrow, we are expecting 3,000 doses of the AstraZeneca Oxford vaccine. We have gotten them through the CARICOM Secretariat. And then the other question speaks to vaccines. Oh, well, I'm not sure why that's the focus. Right now, the vaccines are free. They are offered freely. They're readily available. And so I think we need to capitalize on this opportunity, go right out and accept the vaccine, because it's free of charge. There are no out-of-pocket costing. Thank you.
Ladies and gentlemen, we have now come to the end of our NEOC briefing for today, Wednesday, the 16th of February, 2022. I wish to thank all our presenters for today, Dr. Hazel Loss, Chief Medical Officer and Co-Chair of the National COVID-19 Task Force, Superintendent of Police, Mr. Cromwell Henry, Mr. Abdias Samuel, National Disaster Coordinator of NEMA and the Chair of the National COVID-19 Task Force, and the Honorable Wendy Phipps, Minister of International Trade, Industry and Commerce, Consumer Affairs and Labor, for their usual support, as well as Dr. Marissa Carty. I also wish to thank the entire team who works ardently at making these weekly briefings possible. Mrs. Michelle Christmas Jacobs for signing during the briefing, the Open Interactive team for their continued services, the ZIZ technical team, especially AJ Evans, also our technical team, LeJean James, Mrs. Ophelia Blanchard, and the entire NEMA staff who worked behind the scenes to make these briefings possible. Most of all, I thank you, ladies and gentlemen, for tuning in every week, and I wish you all a wonderful evening. I'm your host, Michelle Rodriguez.
They had it, folks. Another edition of the COVID-19 briefing here on WINNFM 98.9. Don't forget at 6 o'clock, we got the WINNFM News and Sports package.
From the South, 99.